Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CALCASA.
Are going to be hosting a web conference looking specifically at evaluating social norms change and social marketing, but we needed to start with a really good foundation for understanding how social norms change and social marketing are different. So that is what this web conference is really going to help us do. And so we're going to look at defining social norms and social marketing, describing the key elements of social norms change and social marketing campaigns. Gosh, I don't know if I can say social so many times so fast. We're going to look at applying lessons from other social norms and social marketing campaigns from a field outside of sexual and domestic violence, specifically from tobacco prevention, and really think about how those efforts fit within our sexual and domestic violence prevention efforts. And then we hope to engage in a discussion about social norms, social marketing, the differences, and the potential strengths and strategies to prevent sexual and domestic violence. So this is where it would be really great to hear from you all as we go through this conversation. So we know from CDC's Stop SV and Preventing IPV technical packages that changing, influencing, and impacting social norms really cross-cuts many of the strategies to prevent sexual and intimate partner violence. And so you'll see on the screen in the Stop SV technical package, promoting social norms that protect against violence is actually called out as a specific strategy. When we look at the Preventing IPV technical package, you'll see that changing social norms, including harmful gender norms, is a really key aspect that cross-cuts teach safe and healthy relationship skills, engage influential adults and peers, and create protective environments. Those strategies, that challenging those norms are really important aspects of those strategies. And so we know that in both technical packages, changing social norms is an aspect of many of the strategies, even if it's not specifically the strategy is about promoting social norms. So a quick question for you all is, my polling question has disappeared. Let me get it for you. How familiar are you with CDC's Stop SV and Preventing IPV technical packages? These were released a couple of years ago, and so they are both available as well as 3 other technical packages, and we'll put a link to where you can find all of the CDC technical package suite. But it looks like, let's see, many of you have at least heard of the technical packages, but have not read them or put them into use into your work. There are some of you who are regularly using the Stop SV or Preventing IPV technical packages, and then folks who are doing, you've read them, but you haven't used them in your work, or is really helping you understand their application to your work. So for that other category, there's 24 of you who selected that. We'd love for you to pop in how familiar you are if you can't put it into one of those 4 categories. And so some of you have not heard of them at all. It's new to you, this is a good thing. We're going to make sure that you are aware of them and that you know of them. And we do have web conferences that we did in the past specifically on both of these technical packages that we're pointing to today, and so we'll be sure to link those if you are interested in deepening your understanding around that. I'm going to go ahead and take that poll away. Okay, so when we have a really wonderful presenter that's going to really do a deep dive for us around this, but I wanted to just start off by saying that when I think about social norms change, I'm really thinking of they're the what of what we want to change. And when I think of social marketing is one of the hows to go about making that change. Both social norms change and social marketing involve messaging, but they give us different tools. And we know that with different tools, we use those in different settings. So One of the things about looking at social norms change and social marketing when it comes to sexual and domestic violence prevention is that there really isn't a ton of research specifically around our issue. One article that comes to mind that many of you are probably familiar with discusses an evaluation of the Know Your Power bystander-oriented social marketing campaign. And we're going to pop the link for you to learn more about that evaluation in the chat. But basically, that evaluation did find that exposure to the Know Your Power social marketing campaign was able to increase participants' awareness of their role in reducing sexual violence and intimate partner violence. It increased their expressed willingness to get involved in reducing sexual violence and intimate partner violence, and it resulted in participants being more likely to report having taken action to reduce those types of violence. So that's the one that comes to my mind. If folks have other examples, if you know of more, please feel free to put that into the text chat. But what I can say is that we do know that there are lessons from other fields and that we can learn from those. And so, Tori, I think that's a good time to pass the podium over to you because I know that you actually have a personal connection to our presenter today.
Mm-hmm. Yeah, you're right. Thank you, Ashley. So I will introduce Dr. Carrie Lynn Sakuma a little bit later when we bring her on to share her knowledge with us. But her connection to the Prevent Connect community is that pretty much everything I know about social norms and social marketing either comes from the guidance that we've received from the Centers for Disease Control and Prevention or comes from Dr. Carrie Lynn Sakuma. I was able to take her mass media and health class during my Master's of Public Health program at Oregon State University. So when we were thinking of who is someone who has a really great depth of knowledge on this topic and who's really good at applying these concepts across health topics, including when Carrie Lynn was helping me figure out how the heck to do all of this with sexual violence prevention, that is who came to mind for us. So thank you, Carrie Lynn, for joining us today. And we'll go ahead and start kind of clearing up some of the differences between social norms, social marketing, and social media because we cannot be more social in our field. So when we look at social norms, what we're really looking at here is correcting misperceptions and changing the broader cultural perspectives. We also realize that this can be a community and societal level strategy to prevent sexual and intimate partner violence through looking at changing the acceptance and non-acceptance of these broader cultural norms around violence, as well as changing behaviors and mobilizing both people and systems for change. So a lot of the examples of social norms that come out in our field do have to do a lot with gender norms, gender equity, healthy masculinity. Rebecca, I saw that you had a comment earlier about how paying low wages is a bit of a social norm right now that we are gaining some momentum on changing. So thank you for that, and thanks for giving us a great lead-in to plug our next web conference on economic supports as well. So those are just a few examples, and we'll ask you all for some other examples in a moment too. So the Veto Violence tool on the Centers for Disease Control and Prevention website does have more information about social norms change, and they actually just redid their website, it appears, so they've got a couple of different pages and some information for everyone to check out as well. But it's important to keep in mind when we're talking about social norms change, we're talking about changing attitudes, beliefs, and community values that then change behavior. So now when we think of social marketing is a framework for folks to create change, and it's very specific. It's a very specific strategy to change the behavior. Social marketing integrates consumer marketing with public health and other social approaches to create the behavior change. And it absolutely can involve changing social norms as well. So we'll go into, or Carrie Lynn will go into consumer orientation, audience segmentation, and how social marketing creates behavior change in a little bit. And finally, our last social that we'll go over today is for social media. So posting on social media or doing a social media campaign is not by itself a social marketing campaign, and social marketing campaigns and social norms teams can use social media as an element or not. And so Ashley had said this earlier, and I'll just reiterate it again here because I think it makes it a little more clear that the social norms are the what of what we want to change. Social marketing is the how of how we can change those social norms, among other strategies. And social media cannot, and doesn't have to be involved in our social term mix. So I hope that was able to provide a little bit of clarity before we dive deeper with Carrie Lynn. And while you all are digesting that, we would love to hear from you. What social norms are you impacting in your work to prevent sexual and domestic violence? So if you can answer that in the text chat, and we would love to hear more.
We also, Tori, while folks take a moment to answer that, is the concept of social norms and social norms change for preventing sexual and domestic violence is maybe a newer topic for anyone? We do have a web conference that builds another foundation around conversations around social norms change specifically, and so we linked that in the text chat. We do that yearly, and so I wanted to just be sure to call that out, so if folks need more information, they have that there. But it looks like things are coming in, Tori.
Mm-hmm.
So I see lots of harmful gender norms coming up in the chat. So looking at, kind of like those norms that really kind of dictate masculinity and femininity, and people adhering to those strictly. Looking at changing norms around how or whether or not people intervene or even believe that violence prevention is possible. Healthy relationships. There's norms about gender and caregiving responsibility, norms about power and privilege.
I saw one theme come up a little bit around starting this work early with children and youth, not only with teaching consent and healthy relationships and communication from a young age, but also letting kids know that they don't have to hug family members if they don't want to, and letting family members know that they cannot demand hugs or physical affection from children in their lives.
Mm-hmm. Mm-hmm. Yeah, there's so much coming in, so keep those coming. It's great to see what norms you all are impacting with your work, and I think we should go ahead and introduce our guest.
Let's do it. I am so excited to introduce you all to Dr. Carrie Lynn Sakuma. So Dr. Carrie Lynn Sakuma has her PhD and her Master's in Public Health and is a prevention intervention scientist with over 15 years of experience creating and evaluating behavioral programs funded through grants awarded by the National Institutes of Health. Although her primary research focus is on health disparities and tobacco regulatory science, she has conducted research on outcomes relating to obesity prevention, co-parenting, and substance abuse prevention programs. Dr. Sakuma is the undergraduate program director for public health, health promotion, and health behavior option at Oregon State University, where she focuses her courses on social determinants of health. She also teaches the Integrated Approach to Public Health course and other foundational courses, including behavioral theory and mass media and health to master's and doctoral students, like I once was. Dr. Sakuma is most interested in the mechanisms of behavior change from individual to community levels with special attention to the most vulnerable populations. Carrie Lynn, thank you so much for joining us today, and we are so excited to learn more from you.
Thank you. Hello, everyone. Thanks for having me on today. And thank you, Ashley and Tori, for inviting me to be part of this conversation. I'm also really grateful for the shout-out to Oregon State University and our programs here. We also have a new master's program, Master's in Public Health program, that is specifically online and tailored for practitioners. So please do check that out if you're interested. But today, I thought we could first start with who your audience is. Let me get my computer to work here. Okay, who is your audience? Because what we're going to be talking about today really is dependent upon all of you understanding who your audience is. Now, You have been doing this for many years. You know your communities really well. And so these are just different ways of thinking about your audience. For example, your program may be focused on reducing sexual assault incidents on college campuses. However, your campaign may target different aspects of that, or what we call different segments. And we'll get into all those details, but I want you broadly to think about the college population, right? Some of the questions that you might have in front of you for building a campaign for that particular population is things like who that audience might be, whether you should be aiming for folks who have power to make change, who are leaders on the campus. Should they be college students? Should they be administrators? So those are all the different types of ways you can think about it. You can also think about special populations such as LGBTQ, those college students who are young men in athletics or young women in STEM. You can think about those that kind of come together around a specific value, idea, or behavior. As we go through today, you'll see why this is central to both social norms and social marketing.
And Carrie Lynn, we did, as you asked that question of who is your audience, we did have some folks respond. And so there are people who are working with college students. There's also folks working with middle and high school students, youth who, like, outside of school, so maybe in community centers. And then we didn't officially ask it as a question, but there are people that are working in just, like, so many various audiences.
Right. And each group is unique in what their needs are and how they view this topic. And that would mean that each of you would have unique ways of addressing social norms change. And so hopefully, as we dive a bit deeper, you'll be able to tailor and target your strategies to better fit the needs of those communities. So here's a process to understand and respond to your audience's needs. This is a process that we take from social marketing literature, but can be applied to most public health campaigns regardless of what mechanism you use to promote individual, community, or population level change. But what's important here is that this can be done multiple times throughout the development, implementation, and use during the evaluation of a program. And we're going to go through each block in detail, but generally you start with some research, you move into segmentation, and then you move towards targeting your programs to each of those segments. So I'm going to start with research first. Research doesn't have to have this huge, it typically has this connotation of being this huge, expensive, complex thing, but the goals are pretty simple. In development of a campaign, turning to other programs who have seen success, or understanding who they target and how they did this can help you formulate your own campaigns. But every community is different, and each individual group or community has different needs, perceived or actual needs, that really need to be addressed. Each individual group or community seeks different benefits, has different barriers of concern, and some of you have done formal needs assessments and hopefully included community strengths, assets, and ways to assess shared values. However, this may not go far enough. So simple surveys and focus groups could also be helpful here as well. The goal of this research in this context is truly to get to know who you're working with. So let me ask you this. Will all of your community members respond to the same approach? Do you have the resources to reach everyone? Typically, in most programs, this is not possible. And so if the answer is no, then you turn towards audience segmentation. What you want to do is subdivide a broad audience, what we call a consumer market, into smaller, more homogeneous groups. In social marketing, you'll hear the same message, but often with different terms. You'll hear that you could subdivide a consumer market into smaller market segments, and that's where the term audience segmentation comes in. How you divide or subdivide your communities depends on your research. The goal here is to get the biggest bang for your buck. Aim your campaigns to those who have power to make changes, those who need to make the behavioral changes, and those who can help impact those changes. How you do this is based on how you segment your population. Most often you see campaigns that segment based on demographics, for example, age. What works for youth ages 6 to 12 is not going to work for teens 14 to 18. Sometimes you'll see campaigns segment based on geography. You can target places like California versus Virginia or Baton Rouge versus New York City. But you can also target geography like bars versus baseball stadiums because the clientele is different and their needs are different. You can segment your community based on shared values, on similar perceptions, similar barriers, different psychological measures like readiness to change and motivation, and you can segment based on behavior itself. An example of this is those who are sexually active who use protection may need a different message to get regularly tested for STDs than those who are sexually active who do not use protection. I saw some comments going on about how different communities have different needs. And so we're going to get into how to identify some of those needs. What do you do with those identified needs? You target the messages and programs. And so targeting messages and programs to unique needs and circumstances of each segment takes a little bit of creativity. So we've moved from research to segmentation, and now we're on this message portion. You can see who your audience is and how segmenting your audience will really highlight ways in which you can address the unique needs and circumstances of your communities. The goal is not to reach everyone. You cannot reach everyone with your campaign, and your goal is not to reach everyone. The goal is to reach the right people who can impact your population level objectives. Some of you have only enough resources to target one audience segment. This is okay. Some of you may want to target more than one segment to group, and that is great. Again, the goal is to pick the right audience or audiences who have the greatest potential impact on your bottom line to change that target behavior. Okay, is there any questions before I move on to social norms?
Yeah, and just a reminder, as questions come up, feel free to type them in the chat. And, there was already a question, Carrie Lynn, from Tricia asking specifically about applying segmentation to different social media platforms, which might be a little bit more than we can do today, but I think it's a really good question.
Yeah, I can. Yes, you could. You could do that, but what I would ask is, why are you targeting certain social media platforms? Usually you're trying to get to a specific audience, and you still need to know within that who your audience is. By, for example, just putting something up on Facebook, you're going to get a different audience from putting it up on Instagram. And so you can target based on social media, but it's actually much more effective if you target your audience and pick the channels in which you want to reach them. So you want to reach youth, then use Snapchat. If you want to reach out to moms, then you might want to use a mom's Facebook group. So you want to identify who your audience is and then figure out what the best channel is to reach them.
That makes a lot of sense. Thank you.
All right, so moving on to social norms, let's get started in clearing up some of the differences between social norms and social marketing. And let me move my cursor. Okay, so let's just start with definitions so you can make sure we're working from the same understanding. I don't plan on going too deep into theory or history of social norms. Rather, I'll focus on the definitions and examples and application to really give you folks an opportunity to actually use these concepts in your own campaign or check on how you could evaluate them. The social norms in the context of behavior is often described as rules or expectations as to how someone should act in a given situation. So it's just the expectations, sometimes unsaid, sometimes it's obvious, but it's rules and expectations as to how someone should act in a given situation. Now, this may be familiar to all of you, or it should be. Here's a sociological model, and it's a great model to remember that those differences in understanding what's expected in any given situation and who we are in those situations is based in social norms that are determined at the societal level, community level, family, friends, or peer groups, and various contexts. So we're nested within all of these levels, and that helps us determine and understand how we should act in certain environments. For example, a very simplistic version. For example, the way I dress for a business meeting is different from hanging out with girlfriends at a restaurant and is different if I were going on a date. There's nothing wrong if it's all the same, but to consider an individual's perception of appropriate behavior is to take into consideration the influences and expectations that they have learned from their surroundings, their social surroundings, and whether that means interpersonal relationships or societal expectations. They're all related and nested together. So here is a few examples that I like to use to help really drive this perception home. So in the U.S., different cultures dictate personal space. And in the U.S., our personal space is actually quite large. It's about 3 feet. So if you think about when you're talking to someone that you might be colleagues with or maybe strangers, you realize when you're facing them, it's about an arm's length away or about 3 feet away. This changes depending on who you're talking to. If you're talking to family members or friends, you might be a lot more closer in space when you're having those conversations. And if any of you have like young children, if you're standing in line at the store, I mean, I have a 3-year-old and a 5-year-old and a 9-year-old. I'm always telling them to step back from the person in front of them because they're right up against them, nose to butt sometimes. And those are the types of things that you don't realize you're teaching them, that social norms like step back, that's not comfortable, step back. That's them learning what's acceptable in this realm and in this context. Another example that I use that makes things really clear and really obvious is if you imagine yourself entering an elevator. You go up to an elevator, you press the button, doors open, you walk in, you're the only one there. Where do you stand? And the doors close, goes up another floor, doors open, another person walks in. What do you do? Do you still stand where you stand or do you move over? Most folks will move over, and you can see folks actually maximize the space in the elevator. So the doors close, go up another floor, 2 other people who may not know each other walk in, and what happens there? If you take a bird's eye view, most folks move to the corners of that elevator, so maximizing the space between folks again. Now I want you to imagine this. There's a full elevator, perhaps like the one you see in the picture, and you enter the elevator and you just face backwards. You don't bother to turn around and face the door as the doors close and you move on up the elevator, up the floors. What do you feel and what do you think? What do you think others are thinking? Are you comfortable or uncomfortable? That discomfort that you might feel, or the idea that folks think that you're weird, what are you doing, this is totally unusual, all of that is social norms at work. And so you automatically know just what to do. The fact that you feel weird or know others would think you're weird facing backwards is social norms doing its work. And then also, adolescents and young people are especially sensitive to social norms. And that's why they more astutely feel peer pressure, which is another way in which social norms influences behavior. And we'll break that down in a bit.
Carrie-Lynn, I think you just gave a really great example of why we have social norms and why we care about them so much, because, as us, we're expecting that other people will conform to the norm, so we want to conform to the norm. So we don't feel that social discomfort and that social disapproval. And I think what a lot of folks are doing in the field we want to shift these harmful norms and promote these positive norms so people conform to the positive norms a little bit more and really uplift those too. So thank you for giving us such a great visual example of the elevator. I think that's something that is going to make me think a lot more about the way that I approach social norms work too.
Sure, yeah, that's the power of social norms, is that actual discomfort. And hold on to that, because I think we're going to come back around to that in both social norms and social marketing. That discomfort, it doesn't necessarily have to be a bad thing. You can utilize it in that way to make folks conform, but it can also be a nice marker for, hey, I need to pay more attention. And you can use it to shape your messages towards positive or negative. It's just a tool. And then finally, just to bring this to all of your doorsteps, we're always interpreting expectations and norms around us, but each of us come with different influences and knowledge. This becomes really clear when you think about how you have to decide what is appropriate behavior at the end of a date. If you can imagine standing on a doorstep and you're at the end of a date, what is appropriate and what is inappropriate. And so people that come to that doorstep come with all of those influences in their mind, and they're constantly interpreting and reinterpreting. And that's where your programs come in play. All right. So I'm going to break down social norms even further. Social norms is extremely broad, and there's no consensus across many disciplines on its definition or even its mechanisms. What I'm providing here is rooted largely in psychology and social psychology, but also commonly found in many behavioral interventions. The general goal for this is usually cognitive restructuring. That is, we try to change their perceptions and misperceptions. And the idea is that if folks know that very few people are doing this behavior or approve this behavior, then fewer people are likely to engage in that behavior. But often we're trying to restructure how they think about their behavior being so common or accepted by their community. So here we have 3 types: descriptive norms, what actually happens; injunctive norms, what should happen; and subjective norms, what I think others think I should do or should not do. And we'll go into each one specifically with examples. So descriptive norms are actually what happens. Descriptive norms is just information about how a group behaves. There's no value statements, just facts. So here's a couple of examples. If on the top left, it says nearly 95% of regular smokers start by the age of 21. On the top right, every day about 2,100 youth and young adults become daily smokers. And at the bottom, less than 6% of teens still smoke. That's less than the number of landlines still in use. These are all from the Truth Campaign. Note the use of numbers here. It has to be obviously big or feel big. For example, 2,100 youth and young adults. When the number is a little wonky, you can add in a comparison. Here they use landlines as a comparison because youth these days likely think landlines are for dinosaurs and are quite ridiculous. Like, who actually has those? FYI, I do. But comparing those few teens who smoke to that number helps them see how small a number that is. But notice there's no value judgment here. Landlines might be on the cusp of that, but there's no value judgment here. It's just numbers. Ultimately, though, it's not about the participant or the target audience being accurate about those numbers. It's about their wish to fit in and conform to that specific group of important people. The temptation is to focus on getting more folks to recognize the right answer, but again, it's about them wanting to conform to 95% or be one of those that do not start by the age of 21. Here's an example from a sexual domestic violence prevention example. Here, 82% of Washington State University freshmen ask for consent before engaging in sexual activity. So the message here is that it's not hard, it's not uncommon. In fact, most folks do it. You're simply painting a picture that this is normal and expected.
Carrie-Lynn, we have a question just pop up that I just wanted to bring up. So Veronica says a former colleague used to say that stats that we use to promote social change also needed to be believable. So if it's something too drastic, it can backfire and people don't believe it. Is there a way to balance that? Is that something that you've also noticed?
Absolutely. Absolutely. You can't, you have to use real numbers, and we don't really, there is an example coming up that I will point out how to get around that. It absolutely has to be not just realistic, but they have to believe the data is real and it's reliable and it is relevant to them. And so that's where the audience, knowing your audience really helps. This is especially true because numbers, or numeracy literacy is what we call it, but understanding numbers is really actually hard for people. When you say 25% of, say for example, 25% of adults don't have retirement savings. What does 25% actually mean? What does that look like to me? Even if you changed it to 1 in 4, I've heard community members like, well, I know 4 other people, and that doesn't affect us. And so knowing numbers, it's actually quite difficult. And this is why injunctive norms typically is how social norms gets changed a bit easier. And so maybe this will answer some of your questions.
Thank you.
Yeah. So injunctive norms is what should happen. And injunctive norms is the perception of what most people approve or disapprove. And I could do this. Okay, so injunctive norms, if you think about Remember that discomfort in the elevator? When you use injunctive norms, what you're doing is capitalizing off that discomfort. You're pointing out to folks that if you do not conform, you will have these values ascribed to you, or if you do conform, you will have these values ascribed to you, and then you'll feel better. So you're kind of working with that cognitive dissonance, and you're trying to make folks kind of go with the flow of things. And so in this example, that again is from Truth Campaign, teens who see tobacco use in movies have more positive attitudes towards smoking. And what this is actually just stating is some research that shows that the more that they saw tobacco in movies, and usually in movies it is glamorized, that they'll start ascribing those positive feelings to it. And so they will believe that, if they're cool and they're smoking and they're rich and famous and I'm smoking, then I will be cool, rich, and famous, right? So it's those values that you're attributing it. The counter message to that is this Left Swipe That campaign, completely outside of my demographic, but folks are really responsive to it, and they have evidence on how responsive and effective this was. But basically, they used the effect of Tinder, where you left swipe to get rid of folks that you thought was unattractive. And anytime there was a picture of someone with cigarettes in their mouth, in their hand, then the folks would left swipe that. So you get double the matches if you're not smoking in your profile pics is the fact that they use. But again, this was about ascribing those values. Here, they're not even using numbers, and so numbers aren't always necessary, but it does convey expectations and values. In tobacco examples, as in tobacco industry, we see a lot of this. Marlboro Man signifies masculinity, ruggedness, such that it conveys the message that if you smoke this, you too will be a manly man. But anti-tobacco works in the same way, in that if we state that if you smoke, you're unattractive. And so you can work with those messages as long as you understand what your audience what's going to appeal to your audience. And that's the injunctive norms at work. Here's an example that might be a little bit more relevant. Here they did use numbers. So 4 out of 5 gateway guys don't want to hear trash talk about girls. And here's a quote from a gateway student: "Trash talk starts problems. When people say it to me, I get pulled into it. It's best to just walk away. Respecting people is the best way to stomp out hate." And this example is a collaboration between Gateway High School and the Southern Hilltown Domestic Violence Task Force. What do you think this conveys? There's 2 things related to injunctive norms here. 1, that most guys don't approve of trash-talking girls. And 2, it's the approved and accepted behavior is just walk away and respect others. And so the question about data needs to be believable, this is one way to get around that. One, it's really small and hard to see, but at the very bottom of this picture, it says, data taken from 2006 student survey. This campaign is a collaboration between Gateway High School students and the Domestic Violence Task Force, funded in part by, and it gives you the different programs that funded this. Also, if you take a look here, it says your survey, your results, and that's really important, to make the data relevant and believable.
Sometimes, we just wanted to give a real quick shout out to Monica Moran, and I believe Monica is in the session with us today. Thank you so much for providing these examples that we could then use in our presentation. So we really appreciate that. Thank you.
That's a great example of using social norms from the community to help drive the campaign messages. And finally, we come up on subjective norms, what I think others think I should do. Subjective norms is a little tricky, but it's a bit more direct and specific in weighing what I do against what people who are important to me, think I should or should not do. This is similar to injunctive norms, but I like adding subjective norms into this discussion because it really focuses and forces us to examine who we're talking about. Injunctive norms is generally other people think you should do this, but subjective norms focuses us on who's really important to your target community. With subjective norms, it's less about how many people think smoking is cool or uncool. It's focused on how many or how much the target individual wants to behave according to those who are closest to them or those most important to them will see them. So the example I list here, don't risk national championships by smoking cigarettes, don't let your teammates down, presumes that the target audience, being part of an athletic team, is important to them. And so they shouldn't smoke because they'll let their teammates down. Another way of thinking about this is, what would you choose to do if I said, most kids think smoking is cool, versus that girl you like, she thinks smoking is disgusting? Which one is going to win out? When you compare injunctive norms and subjective norms, it just depends on who your target audience is and how well crafted that message is. That's the difference. Both work well, but you might be able to get more effect by targeting your message just slightly different and with more specificity to your audience. So at the end, it is critical to understand who your audience is, to understand who is important to your audience, and be able to craft and create messages to support or counter those important influences. Here's an example. So many of you probably saw the Gillette ad. I encourage you to watch this again because it does a really great job of mixing and contrasting injunctive and subjective norms. And see if you can identify the difference as you watch it. In this example, it shows all of the influences of toxic masculinity messaging that's in the media and demonstrated by folks in that they're surrounded by. But at the very end, it shows folks that will interrupt that, folks that are close to them. For example, a father who interrupts a potential fight, another father who's breaking apart two kids who, it's like, that's not how we act. That's not what's expected. And so you can see how injunctive and subjective norms are being used differently to create those different types of targeted messages.
Thank you, Carrie Lynn. And yeah, I think that ad is a really great example for all sorts of social norms change. And I think what question I keep going back to listening to you talk about this is that importance of knowing your audience and knowing what motivates your audience in order to change the social norms. So I know we asked you all earlier, who is your audience? Who are you thinking of? So kind of based on your own responses from that, what do you think motivates your audience or your potential audiences that you all would be looking at to change social norms within? So go ahead and write your responses in the text chat. And Brenna Merrill, good sex, great. We're going to go into that example a little bit later from the Make Your Move Missoula Make Consent Explicit campaign. So we'll give you all a few minutes to respond to that. Carrie Lynn, while folks are typing in, would you mind sharing some of the lessons learned around social norms change?
Sure. I'm going to advance the slide, if folks don't mind, so that you folks can see. And we can move forward. So lessons learned. Social norms are quite powerful, and especially for adolescents and young adults, but everyone is affected by social norms. Not everyone responds well to social norms, particularly those who pride themselves on going against the crowd or authority, but there are definitely ways around that. You just need to know your audience really well, as the next bullet point says. We also need to think through what is motivating the behavior change. Is it about fitting in and compliance? Who are they trying to fit in with? What messages are they trying? What are they afraid of? What are the barriers? And so those types of questions actually some can be answered through some of the techniques that that social marketing can bring.
Thanks, Kayla. We did have, I don't know if you were looking over at that text chat, but there's a lot of examples that folks shared about what motivates their audiences. And so, I love, Sarah, your comment trying to figure that out, right? We're all coming from a different place and knowing what motivates our audience, right, depending on so many factors. So for some of us, we're still trying to figure that out. For other folks, it looks like, Alyssa doesn't ruin the reputation of the unit and Marines. So that's like a very specific audience, not wanting to ruin reputations. There's also so much around social status, social capital. Tori, what other things are you seeing?
I'm seeing some things that are super connected to very, very close-knit communities. So I saw that same comment about the Marines. I'm seeing comments about church and faith and peer groups and teams. So there's a lot of that desire to either fit in or not be kicked out because someone is perpetrating a violent norm. I saw themes around reputation and empathy with others too, and again, going back to that peer pressure element too, peer pressure can be positive when we're talking about promoting positive norms, and just folks wanting safety and to break the cycle of abuse as well. So thank you all for your responses. Ashley, did I miss any of them?
I think there was wanting to be an influencer I'm seeing. Thinking about, what happens when your audience is very mixed. Is that when the segmentation piece comes into play? Rebecca says, for engaging men in our work, there are a number of men who are showing up as allies, but those who are not are much more difficult to reach. So most men in Ohio, the data suggests that they're not endorsing intimate partner violence or sexual violence, but they do not have the skills to interrupt the violence. So maybe that's a good, that's the motivator. So there's so much coming up. This is a really great discussion. But Carolyn, I think we'll pass it back to you for now.
Sure, this is really exciting, and I love these discussions because it helps to bring to light the realities that we're working in. One of the reasons why I go into the details of the different social norms is because it helps you really target some of those messages and realize where there might be holes, where maybe most of the messages are focusing on, maybe audiences that we're missing, maybe not paying attention to certain aspects of populations that maybe it's just the wrong message. Maybe the norms are just not motivating them in the direction that we want. And so this comes into play when you want to evaluate your program. You can break down what message belongs to which type of norm, and then you can really figure out, okay, this message is just not working, or this message is really powerful with this group. And yes, it all comes down to segmenting. You cannot reach everyone. If you try to reach everyone, you will reach no one. And so part of that is going to come out a bit more in social marketing as we get into that. But something to think about is social norms campaigns can be used to develop the messages that correct misperceptions and move toward behavior change, or create new perceptions that you want them to hone in on and adopt. Whereas social marketing is a framework to create the conditions for behavior change. Social marketing is going to tell us how to do some of this and how to implement a program in a way that can be most effective at reaching those folks with the biggest bang for our buck. All right, so social marketing. Social marketing uses commercial marketing techniques to sell ideas and health to an audience. And if you think about, you see commercials all the time. And I can't help but feel, and I'm sure that you folks have this observation too, that public health is light years behind these campaigns. And so other people have noticed that, and some of them created social marketing to use the same principles that are used in commercial marketing for public health. The key difference here is that social marketing benefits the target audience and general society, whereas commercial marketing really benefits just the company selling that product. They can decorate it any way they want, but ultimately it's about their company selling that product. Both social marketing and commercial marketing relies on an understanding and knowing the customer. It is completely consumer-oriented. And so, again, it comes back to knowing your audience. When planning a social marketing campaign, we use elements of the marketing mix. Sometimes you'll see this referred to as the 4 Ps of marketing: product, price, place, and promotion. Briefly, these are the definitions for those, and we'll go into each one with examples in a bit. So the 4 Ps is product. What are you selling? Price. What does the consumer have to do in order to obtain that product? Place. What must happen for the product to reach the consumer? And promotion. This is the integrated use of advertising, public relations, promotions, media advocacy, etc. And this is to create demand for your product. So keep that phrase in mind. How am I going to create demand for my product? Sometimes you'll see additional Ps. Here's 2 additional Ps that's most relevant, I think, to the work that we all do in public health, which is partnership, which is other agencies and organizations you need to partner with in order for your program to be effective, and policy. Social marketing programs, no matter how good they are at motivating individual behavior change, it cannot be sustained without an environment that supports that change in the long run. And that usually comes from policy changes, whether that's big policy as in big P policy as in laws and regulations, or little p policies, so policies that happen in an institution, in a community, et cetera.
Carrie Lynn, I am so glad that you mentioned that, and my face lit up when you said big P policy and little p policy too. So, yeah, you're absolutely right. Like, we need to have these policies as a key tool to change behavior and perceptions of cultural and social norms, and these policies really send a message to the broader society beyond who we have segmented in our social marketing and our social norms audiences, but our policies can send a message to everyone that sexual violence, intimate partner violence, and other forms of violence are unacceptable.
Yep, absolutely. That's part of changing norms. So you can see how norms and social marketing is starting to really overlap. Setting those norms is through policy changes. And so getting into nitty-gritty a bit, so marketing mix, let's start with product. What are you selling? What is the idea you're selling? What behavior do you want to see changed? Tangible products could be the actual product. It could be giving away condoms. It could be a program or service, free domestic violence counseling, free trauma counseling at the site, or intangible behavioral practices, changes in attitudes, beliefs, or ideas. So you can see how social norms could fit into this by being an intangible product you're selling. Some of these examples, again, in your wheelhouses, could be signing a pledge, counseling or legal services. The intangible might be the message of yes means yes, and community connectedness. So some of those products, what are you really trying to get across? What do you want the audience to adopt? Here's an example. So this is an example from the FDA in their tobacco product education programs. This is called This Free Life, a public education campaign designed to prevent and reduce tobacco use among lesbian, gay, bisexual, and transgender young adults ages 18 to 24 in the United States. Now, this is their motto or their tagline. This new life, free from judgment, free from the shadows, will also be free from tobacco. What is the product that they're trying to sell here? And if you take a look, and there's a video at the bottom, link to a video at the bottom if you'd like to see how they do this. But really, they're trying to sell freedom. Freedom from tobacco, freedom from life. And you can see how that message really transcends between tobacco and LGBT life. And so this is really important to that group, and they capitalize on that idea, and that's the product that they're selling. You can be free. And so similarly, here's an example from another intimate partner violence prevention campaign. What idea do you think they're selling here? And you think about, yeah, go ahead.
I was just going to say that many people on the web conference have probably saw this. It's probably a couple of years old now, but it was from Futures About Violence, the Teach Early campaign. And this video or ad, I guess, it appeared on television. It had a lot of viewers. I'm not using the correct language, marketing language, but hopefully everyone knows what I'm trying to say. So a lot of people, if you watch it, you'll probably recognize it. But so when I look at this, Carrie Lynn, I feel like the product, we're looking at the product as the behavior change, and to me, it's really about like talking to your sons or talking to the young boys in your life. So it's around communication and teaching.
Yeah. I mean, the idea The
I feel
idea
like I'm in class. Yay!
the idea behind this is that intimate partner violence is learned, right?
Mm-hmm.
So start young, teach them otherwise. That's what the bottom line is, and that's the idea that they're trying to sell, right? And hopefully that permeates with their audience.
Mm-hmm.
So price is a bit tricky. So, but this is I think one of the most important pieces to really truly understand. So marketing mix for the second P in the marketing mix, which is price, is what is the cost? Cost can be monetary, it can be psychological, it can be social. So many of you in the text chat earlier, I asked what was motivating folks in the social norm section. And someone put fear, someone put other things, right? Think about that as costs. The program needs to reduce those barriers or costs. Or I see a lot of discussion about folks who do not support intimate partner violence, but they don't have the tools. They don't know what to say. They don't know what to do. They don't know how to feel in a situation if they're confronted in a situation. There's a cost to that. And so part of that is reducing those barriers, getting them able to recognize symptoms and signs and being able to step in when they see something starting up. How do I step in? How can I safely do this? And so there's a few bystander programs that I think did a great job of putting out a comic on giving them like what I call stems or like statements that they can say to help interrupt that potential violence that's going to occur. So, but what you need to remember is that it's not the cost of the behavior, but it's the cost for the person to do what you want them to do. So it's not the cost of smoking cigarettes or the cost of lung cancer. It's the cost of using pharmacotherapy to quit, or it's the social cost of being a non-smoker among smoking friends. So in terms of when you think about your campaigns, what does it cost for someone to even address their own violence or their own perceptions of violence or perceptions of norms that perpetuate toxic masculinity? So those are the types of things that will help you identify messages that might be really effective. And I think.
And Carrie Lynn, that is a really great example to lead us into the example we provide in this text chat question for folks to ponder a little bit. So if you all could respond in the text chat and think about, in this context of price and cost in social marketing, what are the costs of people behaving in gender equitable ways? And how could your social marketing campaign reduce those costs or reduce those barriers to folks engaging in gender equitable ways like we want them to? So we'll give you all a few minutes to respond in there. And Carrie Lynn, maybe we'll come back to the text chat and summarize after we go through placement.
Sure. And I think, Julie, I totally agree. There is a cost. Oh, I'm sorry, that's Ruth. There is absolutely a cost to not doing violence, and that's a message that you have to address in part of your campaigns. What does that look like, and how do you reduce those barriers? And for Julie, yes, I was using examples that we could find, and like both Ashley and Tori noted, that there's not a lot of evidence-based examples readily available. And so if you have some, please do share them. That look at men as being victims as well. And that's absolutely true about this topic, is that we don't have a lot. As far as the third P for placement, where will you deliver the product and how? What is the right place and the right time? Where do your target market members spend their time and make decisions? Programs will want to place products in front of the market audience as frequently as possible at the time that they will want them. And so here's where I know that lots of folks are interested in social media placement. You have to understand, when is it that they're most likely to engage with social media, and whether or not your message is strong enough to get through and be available for them and frequent enough that they'll be able to reach the audience when they need the most. Really good examples of this that I've seen has been in, like, say, if you're gone to the restroom and there's a poster in the stall that says, if you feel unsafe, come up to the bartender and order this particular drink, and we will get you away safely. So those are the types of placements that help folks that in the place, reach folks in the place that they will be at and where they need it the most. That doesn't mean that social media or other posters and flyers aren't helpful. It's just that you have to pay really close attention to where your audience is going to be and when they'll need it. And then I think we have an example that Ashley or Tori will speak about in a little bit more detail.
Of course. Thank you. So when we think about placement, you're absolutely right. We're thinking about, like, where are we going to have this social marketing campaign live? And we also want to think about where are folks going to engage in this behavior. So again, thank you to Make Your Move Missoula for providing this example for us today. So this is part of their bystander intervention campaign, where these posters were placed in bars and other areas throughout the Missoula community. And it's a little hard to read on my screen, so hopefully you all can see it better. The poster says, some dude was hanging all over her, so we took off and got her to leave with us. She was drunk, and we didn't trust him. So not only are these placed in bars, so the actual campaign is taking place in a bar, but it is giving the audience a cue of where they can engage in this proactive bystander intervention behavior when they're out with their friends, when they're drinking, when they're in a social party kind of situation. So that we thought was a pretty good example of placement. Carrie Lynn, did you have anything to add there?
No, I think it's great. Thanks.
Cool. So I think we got a lot of responses in our text chat. So Ashley, what themes did you see come up there?
Oh gosh, there's a lot. So themes looking at, you won't be perceived as cool, or you'll be perceived as less than, whether that's in a gendered way or, again, just like not cool. But I did want to call out two specific ones because they also talked about how to, I guess, reduce the cost. So Paula said, in a high school setting, being seen as uncool or too conforming with adults. So that's the cost. Our program focuses on leadership of youth, so they reduce the cost by demonstrating how being positive can be cool, and it's not seen as an adult-run thing. And then Brenna talked about, and this was also a theme, giving up privilege as a cost, needing to acknowledge that we all cause harm at times, and then to reduce the cost, make the relationships that come about when equity is realized better than the isolated way our society is structured now. So I wanted to just call out those two, but I'm sure you saw lots of good ones.
Yeah, excellent. And so I think some of these are really, actually all of them, are really great examples of how complex the social norms and social marketing can really help each other out in identifying how to best message and how to best reach these different audiences, different segments. So, for example, someone had mentioned, like, how do we address toxic masculinity, particularly those that it's a perception of lost masculinity for the male, and so on and so forth. And part of it is, like, how do you address that? And maybe it's that it's stronger men that or more masculine men interrupt those, or you come up with creative messages that really target at what the barrier and cost is, and not just general. Like, most folks don't believe this is cool. So you can get a little bit more targeted messaging that might be a little bit more effective for that specific group. All right. Finally, we come on to the last P for marketing mix, which is promotion. And this is probably the one that's the most misunderstood, but yet the one that is used the most. So for promotion, it's about the coordinated efforts that come into play where you use the different channels to communicate and create demand for that product and idea. You have to have a really good product, however. Some ways to do this is through public service announcements, kickoff events with media presence, and the use of social media. This is where you can see logos being plastered everywhere, someone starting to wear pink ribbons or yellow bracelets, or a challenge on Instagram. So those are the types of things that you add for promotion, but you have to promote something. And so it comes back to that product. What are you promoting? And so, again, you'll see a lot of promotion, but it really is dependent on how good the initial idea and product is. You want to communicate. It's a strategy to inform, persuade, and influence beliefs and behaviors relevant to the product. I think we have a few examples, but this is more comprehensive. So Ashley and Tori, take it away.
Thanks, Carrie Lynn. So one of the examples that I wanted to share is we pointed to them already during this web conference, Make Your Move Missoula's Make Consent Explicit campaign. And I first heard about this campaign from Katie Cole, the RPE director in Montana. I think Katie is in the web conference, so hi, Katie. And so Katie shared about the Make Your Move Missoula campaign, and then we actually had a chance to talk with Brenna from Make Your Move Missoula. We did a podcast, and we'll link that too if you want to learn more about their campaign. But I know that the campaign is used by the rape prevention and education subrecipients in Montana, which I believe are universities. So just quickly, I wanted to see if I could identify the 4 Ps. So for the product or the behavior change, it's really around getting consent, right? That's what this campaign, the behavior change is to get explicit consent. The price is maybe we have to reduce the cost and the barrier around like fear of killing the mood. I know that's something that comes up a lot when we talk about consent and communication, but I think the payoff, and Brenna talked about this, was better sex, good sex life. Placement, I know the posters, the campaign, there's posters around town, in bars, there's radio ads. I believe there's even ads before movies in the local movie theater. Brenna, if I'm telling any lies, please correct me. But also, as Tori talked about place, it's really clear that the place of these behavior changes is in the bedroom, in a living room, it looks like. And then around the 4th P promotion, there were launch events that happened in Missoula. So I think a lot of towns maybe have First Friday events where there's like arts and music. And so they had a launch event on a First Friday. Their posters were on display. There was a photo booth. They turned some of these posters into coloring book pages. They had consent is easel boards. And then the universities that were also using the campaign also did their own launch events. So I thought this was a good example of a campaign that really hit all 4 Ps.
Excellent.
Yeah, and we have one more example to walk through with folks, and this is Uber and No More's Don't Stand By, Stand Up campaign. And so we also wanted to identify the 4 Ps that are at play here as well. And I've provided a link in the text chat in case this campaign is new for folks. So the product that Uber and No More are selling here, as far as behavior change, we can talk about actual commercial products that might tie into this too, but we'll focus on the behavior change one, is the action of intervening and not being a bystander, but being an intervener. The price and the barrier and the cost that Uber and No More is looking to reduce is the fear or the concern of ruining the fun mood of the night. And the way that they discuss that is that at the end of the day, we want everyone to be safe in order to have a good time. So, and with placement, the campaign exists on social media, in bars, in police departments, in nightlife, both mayoral offices of nightlife and within clubs themselves. And it also says in the campaign, on your screen, you can see it there as well, from the club door to the car door to the front door, friends look out for each other. So that gives 3 very specific places that folks can imagine themselves in to intervene in a potentially violent situation. And for promotion, there was a social media rollout, and our partners at Reliance were a big part of that as well. So Carrie Lynn, did I miss anything on the 4 Ps there?
Nope. I think the placement as well as where these posters are, I'm assuming they're in, like you said, they were in different locations, but also in Uber, possibly on the website, the apps, and so on and so forth. So they probably got a lot of airtime.
Mm-hmm.
Yeah. Good. All right. Coming up towards the end here. So what does this all mean? Social marketing is a way to hone your communication strategies and help you make your message, specifically your idea and your product, attractive, acceptable, and persuasive. Social marketing still requires a strong and effective message, however, and a strong understanding of who that target audience is. And that's where it comes back to how are you changing those behaviors. And so that's where social norms might help you hone some of those messages. Some lessons learned: social marketing forces programs to think of the audience first as consumers. Strategies help programs to lay out all the elements so none are left out. And the audience matters. It does not provide a mechanism for behavior change. The audience does matter. To create a successful program, one must understand what product you would sell to that audience, what the costs are, where and how to reach them, and how to create hype is completely dependent on how well you know your audience. And your audience, again, is segmented. So these might be different for different segments. Let's see. And then, so bringing it all together, there's 2 different types of theories and frameworks, but they can be used completely independently or together. Social norms gives you the tools to impact perception and behavior change through targeted messages. It helps organizations understand the audience, what the motivations are, who are important influencers to your target audience. And social marketing help organize and plan around that message development and delivery, and centers all development of the program around the audience using those 4 Ps. One last thing that I don't have listed here, but I think something that I want to reorient folks to, and I'm sure this is at the forefront of your mind, is that violence often happens when 2 things are present, right? 1, there's a power struggle, and 2, social expectations and norms are broken. And so in your message development using social norms, or in your social marketing, thinking about product and price, understand how powerful social expectations are, and know that there is significant cost to those who wish to ascribe to the norms and ideals you present. And so it really takes some significant creativity on all of your on all of your doorsteps to really get some of those to change. On that note, I hope this has been helpful to you in clearing up some of the differences and overlap between social norms and social marketing. And with that, I think Tori and Ashley have a few more questions for you.
We do. Thank you, Carrie Lynn, for that great summary. We do hope that that folks were able to get clear today and clear up some of those differences. So we want to hear from you how you will apply what you learned today to your work to prevent sexual and domestic violence. So if there's just any immediate action steps that you all are thinking of, we would love to hear that from you as well as wondering, what remaining questions do you have? We've got about 5 minutes left with each other. We have some resources we want to share with you. So feel free to just type any and all thoughts in the text chat, either what action steps you're going to take to apply what you learned, what questions you have, and we will comb through those and get some of those going. Ashley, did you have anything you want to bring out yet?
Yeah, well, so a couple things. We have 6 minutes left, and we're asking what questions you have, and so that might seem like, well, we're not going to get to those questions, so why should I ask? What I want to say is, as with so many topics in our field around prevention, this is not the end-all, be-all conversation. Clearly, there's so much. when it comes to social norms change and social marketing. And so this is knowing what other questions you have will help us craft future content and events. So please do let us know. I also wanted to say, so Carrie said making sure we're not just telling people to change, but giving them the tools to exercise that change. And I think for me, listening to you, Carrie Lynn, talk about social marketing, that's kind of one of the big points, is that we really have to move beyond just trying to change people's perception and really work towards changing behaviors. Mm-hmm. So yes, Carrie, absolutely. So there's lots of things coming up, which is good. Tori, why don't you go ahead and share the resources, and then we can, I will take a look through these.
Great. I can do that. So as you all may or may not have already seen, we have 2 new communications guides both are from Berkeley Media Studies, and the first one, Moving Towards Prevention, is in partnership with the National Sexual Violence Resource Center. The second one, Where We're Going and Where We've Been, is in partnership with Reliance. So both of those take a little bit different of a framework of looking at communication strategies for advancing prevention. So I would recommend that you all check those out. We also have some resources from our friends over at the Centers for Disease Control and Prevention. The Veto Violence Social Norms page is available on this website, and they also have the CDC's Gateway to Health Communication and Social Marketing Practice available online as well for folks to check out. And we do want you all to know that we totally hear you on the need for how we know it, how do we evaluate it. And so we will have a web conference coming up within this year on evaluating social norms and social marketing campaigns to prevent sexual and domestic violence. The date is to be announced, but please sign up on our newsletter at preventconnect.org to receive our registration announcements.
Thanks, Tori. So one thing in our last few minutes that I just wanted to pause on, because this is something that I think about a lot. Colleen had a comment, and Carrie Lynn, I'd love to just kind of hear it's a big question, but any thoughts you might have. And so Colleen says, I can understand social norms as a strategy for changing misperceptions, behaviors around health issues, like smoking, but feel confounded around how to use them to challenge norms around identity-based power hierarchies, like gender, race, etc.
That's a great question.
Right? And
it's
so
a really
10
big
norm
question.
strategies work to modify power hierarchies, because I think it's really helpful to look at other public health issues when we're thinking about prevention, but sexual violence and intimate partner violence, it's
incredibly complex. Yeah,
yes.
It's incredibly complex, and it crosses so many identities, right? It crosses so many identities and hierarchies. And so part of it is you can't do it all in one run, and there's no one message. It has to be concerted effort across many sectors and in many ways. And so when you think about the conversations that's happening right now politically, you can start to see folks really challenging perceptions around equality and equity in the workplace, for example, or what's appropriate, and the whole mansplaining. I mean, people know what that means. Nobody would have known what that meant maybe even just a few years ago, right? What that even encounters, what that means. And so this is going to be slow and long work, and yes, it can change hierarchies. I mean, look at society's change overall about women working, women being able to vote, thinking about race issues and race and ethnicity issues. And so it does take a concerted effort, and it's all hands on deck. It's not going to be one campaign that changes it. So it's going to be multiple programs working at different segments and at different powers. So right now, folks are focused on changing individual perceptions, but really we've got to be working across all levels, particularly at policies, particularly at social environments, the whole bystander, and being able to interrupt conversations that that are not going the way that they should be going, those are important skills to be taught, and I think those are part of the toolkit we need to move forward. Hope that helps.
Yeah,
but I'm also
well,
optimistic.
Yeah, no, I love that. And I think it's also another reminder that, there's no one strategy that will prevent sexual and intimate partner violence, that we really have to be looking at from a comprehensive place. And so social marketing campaigns are maybe one part of a larger strategy. So yeah, that does help. So thank you.
And there's one question that I just wanted to point out too, that was asking about how do you deal with conflicting audiences. That's why you have multiple campaigns. And that's why it's really important to segment, because you cannot address all the different conflicting ideals and perceptions. So that's where segmenting comes in, and that's where social marketing comes in.
Perfect. Thank you. Thank you for getting that. So we have gone straight up to our end time. And I just want to thank you first and foremost, Carrie Lynn, for coming on and sharing your expertise, and really be willing to, talk with a field that is so complex about social marketing and social norms change. So thank you so much for that. And I want to thank, obviously, our everyone that's been part of this web conference today, and for all of your input and sharing of resources and questions and your insight and lessons learned. It's just, that's what Prevent Connect is all about, being able to hear from you all and make those connections. So thank you. This was recorded, so we will be making this available within a week or so, and you will receive an email when it is available. So yes. That is all I want to say about that. And Tori, thank you so much for co-hosting this with me. That really ends our web conference for today. So we will talk with you all next time. Take care and have a great rest of your Tuesday.